Welcome to this video, where we'll delve into ureteral tuberculosis, a serious and often overlooked manifestation of tuberculosis affecting the urinary system. We'll explore its causes, how it develops, its prevalence, the telltale signs, diagnostic methods, treatment strategies, and ways to prevent it. Join us as we unravel the complexities of this condition. Ureteral tuberculosis, as the name suggests, is caused by the bacterium Mycobacterium tuberculosis, the same culprit behind pulmonary tuberculosis. Typically, it doesn't start directly in the ureter. Instead, it almost always arises as a secondary infection, spreading from a primary focus of tuberculosis elsewhere in the body, most commonly the lungs. The bacteria travel through the bloodstream, a process called hematogenous spread, eventually reaching the kidneys. From there, the infection descends along the urinary tract, impacting the ureters. Once Mycobacterium tuberculosis reaches the kidneys, it establishes itself, leading to renal tuberculosis. The bacteria then spreads downward via the urine, infecting the ureter. This infection triggers an inflammatory response, causing the ureteral wall to thicken and become scarred. Granulomas, which are clusters of immune cells attempting to contain the infection, form within the ureteral tissue. Over time, this process leads to strictures or narrowings of the ureter. These strictures can obstruct the flow of urine, leading to hydroder, a dilation of the ureter, and hydronephrosis, a dilation of the kidney. In severe cases, the ureter can become so severely damaged and scarred that it becomes non-functional, a condition known as autonephrectomy, essentially self-destruction of the kidney. Calcification can also occur in the ureter and kidneys, leading to further complications. The entire process, if left untreated, can result in significant kidney damage and even kidney failure. Ureteral tuberculosis is more common in regions where tuberculosis is endemic. This includes many parts of Asia, Africa, Eastern Europe, and Latin America. Individuals with weakened immune systems, such as those with HIV/AIDS, diabetes, or undergoing immunosuppressive therapy, are at significantly higher risk. People with a history of pulmonary tuberculosis are also more susceptible. The prevalence has decreased in developed countries with effective TB control programs, but it remains a concern globally, particularly in resource-limited settings where diagnosis and treatment may be delayed. The signs and symptoms of ureteral tuberculosis can be varied and often subtle, making early diagnosis challenging. Patients may experience flank pain, which is pain in the side or back. Urinary frequency and urgency are also common, as the inflamed ureter irritates the bladder. Dysuria, or painful urination, may occur. Hematuria, or blood in the urine, is another possible symptom. Some patients may present with symptoms related to systemic tuberculosis, such as fever, night sweats, weight loss, and fatigue. In advanced cases, where kidney function is severely compromised, symptoms of kidney failure, such as swelling in the legs and ankles, nausea, and loss of appetite, may develop. Diagnosing ureteral tuberculosis requires a comprehensive approach. A urine sample is usually taken to look for Mycobacterium tuberculosis. This can be done through a urine culture, which attempts to grow the bacteria in the lab, or through molecular tests like PCR, which detect the bacteria's DNA. Imaging studies are crucial. An intravenous pyelogram, or IVP, which involves injecting a contrast dye and taking X-rays, can reveal ureteral strictures, hydroder, and hydronephrosis. A CT scan or MRI of the abdomen and pelvis can provide more detailed images of the urinary tract. Cystoscopy, which involves inserting a thin, flexible tube with a camera into the bladder, allows direct visualization of the bladder and ureteral orifices, the openings where the ureters enter the bladder. Biopsy of the ureter, if possible, can confirm the diagnosis by identifying granulomas in the presence of Mycobacterium tuberculosis. Ureteral tuberculosis isn't typically categorized into specific types, but rather stages based on the severity of the infection and the extent of damage to the ureter and kidney. Early stages may involve mild inflammation and granuloma formation, while later stages are characterized by significant strictures, hydronephrosis, and potential kidney damage. The treatment for ureteral tuberculosis primarily involves anti-tuberculosis medications. These medications, typically a combination of drugs like isoniazid, rifampin, pyrazinamide, and ethambutol, are taken for a prolonged period, usually 6 to 9 months. In addition to medication, surgical intervention may be necessary to relieve ureteral obstruction. This can involve ureteral stenting, where a small tube is placed inside the ureter to keep it open. In more severe cases, ureteroplasty, which is surgical reconstruction of the ureter, or even nephrectomy. The removal of the affected kidney may be required. Pain management is also an important aspect of treatment. Preventing ureteral tuberculosis relies heavily on controlling the spread of tuberculosis in general. This involves early detection and treatment of pulmonary tuberculosis, vaccination with BCG vaccine in areas where tuberculosis is prevalent, and ensuring proper hygiene and sanitation. Individuals with weakened immune systems should be screened regularly for tuberculosis and receive appropriate preventative treatment if necessary. Public health initiatives aimed at raising awareness about tuberculosis and improving access to healthcare are crucial. The prognosis for ureteral tuberculosis depends largely on the stage at which it is diagnosed and treated. Early diagnosis and prompt treatment with anti-tuberculosis medications can lead to a good outcome with minimal long-term damage. However, delayed diagnosis and treatment can result in significant kidney damage, including chronic kidney disease and kidney failure, potentially requiring dialysis or kidney transplantation. Recent research focuses on improving diagnostic methods, such as developing more sensitive and rapid molecular tests for detecting Mycobacterium tuberculosis in urine. There's also ongoing research into new anti-tuberculosis drugs and treatment regimens that are shorter and more effective. Furthermore, research is exploring the role of immunotherapy in boosting the body's immune response to combat tuberculosis.